for some more people? No? Count heads, everybody count heads, how many heads, how many box? No? Someone come in. And Shazzy, any of our? Yeah. Very tiny. So, I think we should start with the introduction so that we can start sharp at 9. So let me just say a few words. Is the camera? Oh. All right, so okay guys, you can put away your laptops and everything else and pay attention to our session today. Assalamualaikum and good morning to everyone. Okay, on behalf of the Department of Health, Faculty of Medicine and Health Sciences UPM, I'd like to welcome everyone to this morning session. We are extremely happy and honored to have with us today Professor Mustafa Younis from Jackson State University. Prof. Younis holds a PhD in Health Economics and Finance. Also has Master of Business Administration, International Trade Accounting, and also Master of Arts and Political Economy. His areas of interest include health economics and policy analysis, healthcare, finance, and financial management. Professor Younis, I've read through his CV as an impressive list of research grants, among which include research on Katrina Hospital Surveillance System, quality healthcare for minorities, and many more. Similarly, Prof. Younis has an extensive list of publications, including 60+ peer-reviewed research and probably more now, and also published a book. He's also a guest editor and editorial advisory board member of several peer-reviewed journals. Prof. Younis also received many honors and rewards, including College of Public Service Researcher of the Year Award from Jackson State University, US. He teaches healthcare administration courses, health financial management, health economics, health policy and public health courses and management, strategic management, health management information system, public finance, and also budgeting. So indeed, we are very privileged today to have with us Prof. Younis, who will be delivering a lecture on healthcare reform in the US and also some states, some other countries in the world, and the lessons that we can learn from these countries. Yeah. So without further ado, please welcome Prof. Younis.
Thank you very much. Well, first of all, thank you very much for coming and taking your time for this presentation. So I hope you'll enjoy some of the information here. And it's very basic, interesting reform. I talk about reform in the United States and comparison with different countries. So basically here I put the title, American Healthcare Reform from Policy to Reality. The reason, if you look at public policy from maybe the 40s, there were very good public policy written by think tank in America in the 50s, 60s, 80s, 90s about healthcare reform and healthcare, but they go nowhere. So here's the policy need to be a reality. So here, Obamacare, it was a policy building over time, then how it became a reality. Even after it passed the Congress, there was some problem, it might not become a reality by revealing it. So let's first give you some background. And here in the background, I have the data before 2008. The reason, I mean, the figure changed now, of course, but I have to keep focused before 2008, the healthcare reform, or 2008, 2010, because that was the situation pushing for healthcare reform, the data and statistics at that time. So let's go for first slide. The next one, please, this background, yeah. Here, United States healthcare system. What is the United healthcare system? They say it is a private or it is public. And here what is really the reality it is. We have 4 ways in serving and financing the healthcare. Okay. The first one, the first form called the VA administration. The VA administration is for people who serve in the military and discharge with honor. So after they discharge, there's VA hospitals. They can go see out-of-patient doctor or do surgery and so on, called the Veteran Administration. And it depends on the person's service in military, how long. It depends in those situations, how much they contribute in military, how much it costs them. So like 2 people serve in military, someone might go pay $25 per visit, someone might pay $20. Also, if they were discharged due to war, accident, and disabled. So it varies the payment, but it's financed directly by United States government from the tax we pay. The taxes we pay, they take some money for the VA. So when you look at it, then this will be similar to United Kingdom National Health Service, which is financed by taxes. The second one is the Medicare, which covers the elderly and disabled, okay? And also Medicare and Medicaid. The Medicaid for the very poor people with very low income. And the Medicaid qualification to get Medicaid vary from state to state. It's the state have more control about who qualify to get Medicaid. So in some states, they are more generous than others. Like in California, you might be above poverty line, you get Medicaid, but in other states, you must be below poverty line or so on. But it is for the low income, the very low income population. And this is financed by the federal government. Medicare is from tax. People, when they work, they pay certain amount and matched by employer. Medicaid is from the tax covered by the government to help the state, and it is funded by government, the federal government and the state. And the ratio vary. Like if you go to poor state like Mississippi, for every dollar in Medicaid for the low income people, the federal government put 78 cents and the state put 22. If you go to California, don't take the figure exactly, roughly. The federal government put about 56 cents and the state put 44. So when the state is wealthier, they put more money. The government, federal government put less money to fund it. But the management of the system and control of it given to the state. But the federal government, as you see, is the lowest pay 56% to about 80% in Mississippi and Alabama. So this will be similar to single payer system in Canada. In Canada, they have single payer system paid by the government. Why we say single payer system? Because in Medicare and Medicaid, you go to private healthcare doctor and paid as a single payer system to the physician and hospitals. Then we have a private. The private is an employer-sponsored healthcare system paid by employer, okay? So here for me, for example, I work for the state, but if I work for even a private company, if you have 50 employees or more, usually they give you health insurance. The health insurance doesn't cover 100%. It varies from employer to employer and from state to state, if you work for the state. If you work for a small private company or even a private university, you might have better or fewer health coverage than public. It depends how much they want to contribute. So the rule of thumb, like in our state and even other university employee, we pay 80%, sorry, the insurance pay 80%, we pay 20%, we cover. Okay, so 2022, if I go to 1990, the ratio was different. And in 1990, I remember you go to get medicine, you pay nothing. Now you pay $100 or $150 for medicine. Then after that, it kick in, certain medicine cover 80%, certain cover 50%, depend like generic, non-generic. So here what I'm saying, you have a cost shifting. In a way, from 1990, the employer gives you health insurance, but doesn't cover you as good as it used to be before. By what? Cost shifting from the employer policy to the employee. So here you have to pay more for healthcare than what we used to do 30 years ago. And the reason they did that is very simple logic, that when we have to have higher share for paying for health insurance, will consume less. Like when I used to go to the doctor, pay 20% before I pay 10% or nothing, then I will hesitate to go to the doctor unless really I need to go to. Or pay $25 co-payment, used to be $5 co-payment. So then 10, 15. So this supposedly reduce our visit to the healthcare facilities and service, use of service. So reduce the expense on healthcare. Then we have out of pocket. There's people who don't have health insurance. I can give you an example. Before Obamacare, I mean, all this about healthcare reform, a lawyer have his own office. He told me that about 25 years ago, he doesn't have health insurance. He says he's about 32 years old, healthy, and he have to pay about $10,000 a year insurance. You say, no, I can use the doctor, pay out of pocket. See the doctor, maybe I pay $1,500 a year and save the rest. And he doesn't have health insurance and doesn't want to buy it. He'll have his own business as individual. So you have people out of pocket. They have other people like have a grocery store, mostly South Korean and Arab people in America have a grocery store. And he doesn't have health insurance, he and his family work. So if they need it, they have to go out of pocket. So here then you find if we need to do healthcare reform, theoretically, it's very easy in America. If we want to do the United Healthcare System, just do the VA for all, make the VA for all. And if you hear in election in 2004, 8, 12, 16, 20, like Larry and Bernie Sanders and others, and Biden say he'll keep Obama healthcare and make it more generous and strengthen it. Sanders said, no, let's have the Canadian system, Medicare for all. Medicare for all mean Canadian system, single payer. So it's very simple. We can go Canadian system, make Medicare for all. All we can have mix private and out of pocket. The conservative usually, they prefer to go for private and out of pocket. The liberal, they prefer as something might be feasible to go for B. Very few people talk about A, like the British system, because they find this maybe will never happen for the next 20, 50 years, but say this might happen. How does they try to have this to happen? During Clinton administration, he said, let's have Medicare start, instead of age 65, start at age 55. And of course, the Congress refused that. Then he went for something else. You say, okay, children with certain income, not poor income, middle income, at that time was family of four making $35,000. So below average, the average was maybe $45,000 for family of four. Their children has a free health care till age 18. And it passed the Congress. So they tried, okay, let's get some from the bottom up, some from 55, 18, then start moving. The 55 and rejected. Then in 2008 to 2010, Obama administration said, let's do it till age 60, Medicare for all. And did not pass by all Republican conservatives and Democrat conservatives. So he could not do it, did not pass, so they kept it 65. Medicare by the all is not a heaven, to let you know. Okay. Medicare cover 80% of your expense and have no limit. Like if you go to doctor and get $1 million bill in the hospital, then your share 200,000. In my health insurance, if I go and get $1 million bill, my share maximum $24,000. Certain policy give you $15,000. So Medicare is not generous like my own private, my own employer insurance. You can go unlimited. So how older people with limited income do that, handle it? They go what called health maintenance organization, Medicare, where their limit maximum will be $3,000 a year. But they have to go to certain hospitals, certain doctor. Okay. Or they can buy additional insurance. Right now, it costs about $150 a month, which the additional insurance covers at 20%. Okay. Then you have people who are very poor on Medicare. The 20% they go apply for Medicaid. So the state covers the other 20%. They have Medicare and Medicaid together. Okay. So that's basically how it works, the process. Next slide, please, Mustafa. So here we say how we use the healthcare service in America, but where does the money come from? The money comes from public funding, Medicare and Medicaid, and the VA administration. And that statistic before 2010, 46%. So here you find the federal government and the state government, they have very large share of financing healthcare, but very low share of providing the service, because they provide the service only through the VA administration, which is very small, very few. Okay. Like you didn't have VA administration in every city, for example. You have it in bigger cities, like in, so because very small number of people who discharge from military. But Medicare and Medicaid is very large, but the government doesn't provide the service, doesn't have facility. They fund it and pay for it. So you find here it's very large. So in reality, I mean, the healthcare system in America is not free market capitalism because the government has about 50% of financing it. Private insurance is provided by employer through employment, 41% of the expense. So it's less than the public. Patient out-of-pocket funding, they pay about 13%. People who pay out of pocket. So that gives you an idea where the money comes from. Mostly from federal government, then private insurance. Okay. And the spending on healthcare is estimated to be about $2.9 trillion, which is a lot of money, 2.9 trillion. I mean, it's bigger than the size of economy of Malaysia. Okay. So as you see, the government play mostly major role in financing of healthcare, not to providing it, unlike other countries. Next slide, Mustafa, please. So here where the money is spent, hospital care 31%. Around 1990, hospital care was 40%. Their share went to 31.1%. And that what call inpatient. One reason for reduction in it is technology. With technology, a lot of the procedure went to outpatient service. So hospital provide outpatient that consider by itself. Okay. Physician and a clinic, 20%, 21%. Medicine, we spend about 10% on the about the $3 trillion we spend. 10% of it go for medicine. That is the prescription. Okay. Nursing home, about 6% for people who are disabled or very old and family cannot take care of them or have no family. Home health care, about 3%. Then you have about 30% go for dental, public health, equipment, and administrative cost. One way we can reduce spending on healthcare by tackling administrative cost. So the research shows for a private health insurance, administrative costs go up to 20%. For Medicare, which is a public program, Medicare and Medicaid, 3%. In Canada, which single payer system, similar to Medicare, 1% administrative cost. So here, if you go to Canadian system, you can save about 19%, which is a lot of money when you look at trillion of dollars. It's not $100. Or Medicare for all, you go to 3%, you can save also a lot of money from 20 to 3%. So that is something very important. And administrative costs, like when you go to doctor, they have to file with your insurance. And I can take it from my personal experience. Sometimes I get from my insurance, your bill is, you owe $450 is not covered. So I call them and say, why? Say, because the code for my service for the doctor show I did so and so, that is not covered. So I call my doctor office and say, I came for back pain or stomachache. And here you are doing something else. Okay, we'll correct it. All this consider cost. Okay. And they correct it, then I don't have to pay the $450. I have to pay $25 only. So those mistakes in billing and time for billing and follow up in billing between insurance provider and patient. I mean, it's time consuming. God miss it. Then, of course, salary for people in private insurance making maybe $10 million a year salary. Of course, the vice president, 8 million or 100 million salary with bonus and stock options. All this goes under administrative cost, also salaries and so on and so on. Because many insurance companies are in stock market, like United Healthcare, Cigna, Aetna. I guess Cigna merged with Aetna merged with other company, but it's still a private insurance. Next slide, please. So here we say always, especially conservative, American healthcare system is the best in the world. So let's see what, as we say, where I grew up, only God is perfect. So everything advantage, disadvantage, nothing is perfect except God. So whatever he says, the best healthcare system still have advantage and disadvantage. Same if you go to UK system or any system. So let's look here. This in the United States, the wait time for certain procedure is very short. And it might be true for many occasions. I have people know, like in Jordan, for example, get free healthcare for hip replacement. They have to wait a year. In Canada, like doing some procedure, they have to wait 3 months, where you can do it maybe 1 week notice in America. Well, that's fine. The disadvantage for the wait time, That if you have a good health insurance, you don't have to wait. But if you don't have health insurance and you don't have the money out of pocket, then your work time is not a week or a year, maybe 5 years, maybe forever. So you have to look the other side of it. Like when they said in certain country to buy a car, you have to wait and register with the government, wait 5 years to get a car. You go to America, you walk in and say, I need to buy this car. You buy it within an hour and leave. That's true if you have the money. But if you don't have the money, you don't have car. So here's the same way. I mean, if you have the insurance, you have the money, you get it fast. If you don't, you wait longer than places like in Malaysia or whatever. So you have to look at it, or Canada or United Kingdom. So you have to look at it both ways. Availability for new treatment and drug, that also true. America is the leading pharmaceutical companies. Of course, they have other good company in Europe and other countries, but that's a big one. I mean, United States, Pfizer and Eli Lilly and so on. So you can have it there, but still affordability. Even now, if you have health insurance, like my health insurance, some of them you cannot afford it because it's very expensive. The insurance doesn't cover it if it is a new, or cover maybe a little bit of it. I recall personally, went one time to the pharmacy, pick up a medicine, and he told me it cost that much money. I said, I don't need it. Why? He says the insurance doesn't cover it. It's something new. Okay. So I told him, no, I don't need it. That's fine. So it's available, but either you have to pay for it. I can afford it, but I felt I don't want to pay that much. I mean, but some people cannot afford it. For me, I could afford it and pay about $200, but I said, for what? Okay. So it goes both sides also. Affordability, same thing, depending what kind of insurance you have, how much they cover, or you don't have health insurance. You can say if you are poor, you have Medicaid, it's very good. They cover everything, Medicaid. But it varies from state to state, like state of Tennessee, for example. You can get only 4 or 5, I forgot, 4 or 5 prescription drugs, which is considered good. Like for me, I have only maybe 2 prescription drugs I use, and maybe I can give it up also. But some people very sick, they need maybe 7, 8. Then, and they are very poor, then they have to decide which 5 to use or which 4 to use and which to give up because they cannot afford it. So there are limits, I mean, on okay. Medicare for affordability, Medicare did not pay for a drug. And that was an oversight in 1965 when they had Medicare, they did not include the drug coverage. Then after George Bush got elected in 2000, they pushed for drug coverage and make Medicare Part D for a drug. It's still better than nothing, but doesn't cover everything. You have to enroll in it and it costs you a little premium and you cover certain amount and certain level and drug. So it's an improvement, but it's not completely free. Okay. Then you have acceptance for individual in certain plan like Medicaid. Medicaid, certain hospital and doctor refuse to take Medicaid. So sometimes you have it, but you are limited where to go. Okay. Like I know for one health plan for outpatient in the city of New Orleans, they have maybe 20 clinics and they have only 2 of them will accept Medicaid because they don't want them to go to any clinic. I mean, you have it in certain area. So sometimes you have it, but not everybody will accept it. When you call the doctor, usually say, I need an appointment. They say, okay, like, what's your name, whatever, what kind of insurance you have. Then if you say, I have this insurance, they might say, we don't take it, okay. And some of them, when you say I have Medicaid, say, sorry, we don't take Medicaid. or you have certain insurance, certain companies, they might say, we don't use it because the doctor and the hospital make agreement with the insurance to take this one and this one and this one. Okay. So that will be some issue. So this all background I'm giving you for how the healthcare reform come and what's the problem we have to move for healthcare reform. So this is like background still. Next slide, please. So here they said, let's solve the problem of healthcare. Like everything, people give their opinion. Let's do it like the conservative private healthcare competition. But in reality, I mean, if you have the basic economic concept of a free market and competition, the healthcare market is not free and there's no competition. So it's not there, but that's the idea. So one of it is a mandatory private health insurance coverage, okay. And that basically passed and signed by President Obama in 2010. So that is Obama healthcare, make mandatory private health insurance coverage. The other one, as I say, expands the VA system to be like United Kingdom, or expands the Medicare for single payer system. Okay. And the conservatives say introduce more competition and make, when you buy health insurance, the tax deductible. And when you save money for health insurance will be also exempt from taxes. That is fine if you have good income. Because if you don't have good income, you don't have to money to take tax deduction, so on. Okay. The fourth one, it was my idea. I wrote it in 2007, so you can find it there. It's not really my idea 100%. Like if you want to look at, when you read the economic history, you find a lot of ideas sometimes was even before Jesus' time. They come and talk about it now. Like during the Roman, they have taxation system, whatever. So in the 70s, early 80s, for example, a guy, they put him as very much famous for President Reagan, what called supply side economic. So when they asked the guy, told him the curve he did for the supply side, they call it in his name, Loeffler curve. He was a professor at UCLA, California. And he told them, this is not my curve, this is Ibn Khaldun curve. So he took the idea from Ibn Khaldun, which was around year maybe 1500, something like that, 14 something. If you heard about Ibn Khaldun, and a Muslim was from Spain, then moved Tunisia and Egypt most of his time and wrote a lot in sociology and dying of empire and taxation and so on. So he make it like a curve. When you tax too much, you get less revenue. And when you tax too little, you get less revenue. So the supply side, you say you tax less, so people, you get more revenue by people working more and doing this. So he make it, and they say, he told them, he was honest. He said, it's Ibn Khaldun. So here also, I did it, but I took an idea from someone. I'll tell you who's he. My idea was to do one of two things. Either have one health insurance, a private health insurance company. And in the United States, single monopoly is heavily regulated. So have a single monopoly insurance, one company. And this will be heavily regulated. Then they cannot charge you what they want. The government have to look at their charge rate and charge them. And that basically happened in what? Electricity in the United States and water. You have one company provide electricity in the state or a few states, not many. So you have no choice. Then when increase electricity rate, they have to make strong justification and the government agree on it. And they can say, no, this is too much. And sometimes even they ask them to give us a refund if they're overcharged or something like that. So this way you can control the insurance rate because it's controlled by the government. Or the second option, I suggested to have a quasi-government insurance firm. Quasi-government, and so here I got it from the single monopoly policy in America, this idea. The second one, quasi-government, is to have the insurance companies, one or two or three, to be owned by the government, but behave and act as a private insurance. Okay. Then all the profit will go back to the government to use to subsidize the health insurance. Also, when they are owned by the government, they the government have control about administrative cost and compensation. Like as a government employee, you might make 600,000 a year, but when it is a private insurance, you make 20 million a year. So here you can also control administrative costs. Where I get this idea from, in Kuwait in the 70s and 80s, I don't know about now, they have what called KNPC, Kuwait National Petroleum Company. It acts as a private company, but is owned by the government. And all the revenue go to the government, and the government has this social system in Kuwait with free education, free healthcare, but act like that. There's a guy called, forget his first name, his last name, Lang. He's a Polish economist, moved to the United States, to University of Chicago, then became representative of Poland after World War II in the United Nations. He said, let's nationalize the oil companies in the United States, same like in Saudi Arabia and Kuwait, and let them behave as a private company, but all the revenue come to us as a government for a program. So here basically comes this idea. Of course, as I say, many ideas, but nobody cares. But I write it to promote it. Maybe we can think about it here in Malaysia. Now they say, United States cannot afford to have universal healthcare system and give a free healthcare. So let's say, how true is this statement? So we look at it, we say United States have about 5% of the population of the world, but they have about 25% of the wealth of the world. So that means the country have a lot of economic resources to implement universal healthcare. So what it needs is the political will to do it. Really, the money is there, but there's no will. Like when you look at the homeless, you go find people sleeping in the street. There is money to solve it, but there's no will to solve it. Okay. So many of the problem, I mean, is going on. Next slide, please. So here we need it for all what the previously talked about it. For Obama Healthcare. Obama Healthcare officially is not Obama Healthcare, it's Affordable Care Act. Affordable Care Act, that's what it is, ACA. Okay. That around the time it passed, okay, 17% of full-time employee and 25% of part-time employee between age 19 and 64 have no insurance all the year. Because at 65, you get the Medicare, and below 19, you get the child health insurance program. So that's the area. And around the time it passed, you have about 50 million non-elderly under age 65. They don't have insurance. Okay. And another 25 million, they consider underinsured. Okay. So we have 50 million where have no insurance at all. Then you have another 25 million underinsured. What do we mean by underinsured? That you have insurance, but doesn't cover much. So you don't pick up the medicine because you cannot afford it. or you don't go to doctor or hospital because you cannot afford it. The insurance doesn't cover much, okay? They have a criteria for what is underinsured. If your share of health insurance, at least 20 to 25% of your net income, then you are underinsured, okay? And that is very easy. Let's say at the university, if you are a professor, you are making, let's say, $100,000. But if you are janitor, pick up the garbage, maybe you are making $20,000 or 25. Both of you have the same health insurance because you are a state employee or university employee. Then you can afford to pay the 20% and whatever as a professor. But as janitor, the same health insurance, you can't afford it because your salary too low. Then you are underinsured, okay? So you can be working for same employer, but with the low income, you are underinsured, okay? So that basically, the next slide, please. Okay. Then another reason we needed the reform, that United States lag behind other industrial nations in many healthcare inequality indicator. Okay. So they estimated a lot of wasted money in poor quality, 30 to 40% of every health dollar. I mean, the quality indicator, of course, is debated because what is the indicator you have and why? For example, one of my friends told me infant mortality is higher in the United States than in Europe or than in Cuba, or maybe than Malaysia. He told me that is not indication of poor quality. He said, because the technology advancement in the United States, you can have very difficult cases go for full pregnancy, and some of them very good life pregnancy, some of it go for poor delivery or poor health delivery because of like 6 months premature, born in 6 months instead of 9 months premature, whatever, then they die, then go under infant mortality. So there is debate sometimes about some indicators, why it is, or sometimes how you use indicators, like mortality rate, okay. Mortality rate, all of us will die. So how you look at mortality rate as poor indicator. So here you have to look at other country, what's their mortality rate to say, is that the same indicator or not for mortality? So in the United States, say, if you like die within certain number of days after surgery or admission to hospital or during the admission, okay? But you have to adjust it to age and severity of illness and so on. Because doing a hip surgery for someone 80 years old is not as bad, is not as good rate of success or heart surgery like someone who's in their 50s or 60s, okay? But still, I mean, overall consider lower quality than Europe, advanced countries. Next one, please. Then here, let's come talk about Obamacare now. We give you the background, what's going on, and so on. Then actually Obamacare, if you look at it, or Affordable Care Act, if you look at the history of healthcare reform, it was what the Republican proposed in the 90s. When President Clinton became president, they have what we call healthcare reform, which is failed. And that time, what he proposed, the Republican made counter proposal. And the counter proposal they did, it what Obama had in 2009, 2008 campaign, and could become president in January 2009. So basically, it is was the counter proposal. And here, many people say why the Republican opposed Obamacare or Affordable Care Act, and it was mostly similar to what they proposed in the 90s against healthcare reform. They said two reasons. One reason, many of the people in the Senate and the Congress in the 90s, they were no longer there. There were a new breed of people there who have different ideology. The other reason, they say, in political science, they have what called defensive mechanism, just to oppose Clinton care. They make a counter proposal. So for legacy, for like Social Security, Medicare is legacy of the Democratic Party policy. So they don't want to have legacy for Democrat to have healthcare reform. They put some proposal, but they were really not interested in it, just counter proposal. So when it came to it, they are not interested because they are, I mean, he did not propose something else. If he proposed the same as Clinton, maybe they oppose Affordable Care Act. Yeah. So let's go for next slide. Okay. So Obama administration made very clear the Affordable Care Act is not only for insuring people who are uninsured. Okay. It's also to improve the quality of healthcare, the cost, and the quality of healthcare. So it has a lot of component beside insuring people. The insurance part for Obama healthcare of affordable care really have nothing to do with me or people like me, because we are insured through our employer. What is targeted, the people who are uninsured, the 50 million, those are the people they focus on. How to get them to be insured, okay? And over a number of years, okay? So let's go to the next slide to see what will change, okay? So the healthcare reform enacted in March 2010, so it took them about over a year to be a law, okay? Have 90% of non-elderly citizen and legal resident expected to be covered by 2019. Okay, now it's 2022, and we know it did not achieve that. Okay, we didn't get 94% of those 50 million to be covered, but we have very big number covered. Okay. Also, we expected to save some money because you look at cost and equality, to save some money over 10 years, like by 2020. The next slide, please. The good thing is the new law that the new consumer protection, okay, just as dropping the limit on limiting lifetime benefit and keep children in family health plan up to age of 26 from 24, for example. What we mean by that, before this law passed, our children, we can put them on our insurance. It's not free, we pay, but not much compared to private, until they get to age 24. Here they make a change up to age 26. So we have, like, for example, children, we keep them, we pay about $500 a month extra to insure the children till age 26. And that helps them because they need to go to college, then look for a job, get settled in job, and so on. So that is good. Also, he included preventive service to be free, like breast cancer screening, cholesterol test, okay, colonoscopy every, I guess, 5 years. You do it without paying any deductible or co-payment, like 100% free. So this to improve the quality of preventive healthcare for women to know about if they're getting early detection of breast cancer or cholesterol or so on. So that is supposed to improve the quality of healthcare and reduce costs, because when you get it early, you don't have to go for advanced stage. Next slide, please. Okay. So they expected the premium will go up to those in more coverage, but it's going to go down later on. Okay. Something also good in the new system, the insurance company will not cancel your coverage if you get sick. Before, if you are sick, they refuse to sell you insurance, include you, or when you get sick, the insurance finishes like by, say, December 31st. They say, we are not renewing your health insurance next year. Bad luck if you are sick. Okay. So now legally they cannot do that. You have to keep insured over there. So that was something good too. Okay. Which improve equality. Okay. Next slide, please. Okay. And the policy, of course, started to go over a number of years. It passed in March 2010 and started taking effect gradually over a few things. Okay. Starting 2014, no one can be denied coverage on a pre-existing medical condition. And that's what I say, like you are already sick, they will not insure you. By 2014, like 4 years after it passed, gives the insurance 4 years time. They cannot deny you coverage. They have to give you coverage. Okay. People with up to 400% of poverty level will get subsidy to buy health insurance. So the poverty level for a family of 4, I guess maybe $14,000 or 15, I don't remember exactly. So multiply by 4, so up to $50,000, you can get subsidy from the government to get lower healthcare cost. So I remember when it passed in 2010, they said if you are a single person making $15,000, you pay $25 a month for health insurance. You buy it through the government. If you make it $25,000, you pay $50 a month. So it is affordable to have health insurance. Okay. Then he made something here that everybody must have health insurance. You must buy it. If you don't buy it, you have to pay a fine starting 2014. Okay. You have to pay a fine. Okay. And when you file taxes, you have to include information about your health insurance. If you don't have it, you get fined. You have to pay it, increase your tax. So it passed as a law, with opposition, of course, from conservative. Next. So here's the reality. That was the policy it passed. The Congress here becomes the reality. 26 states was controlled by the other party, Republican. So 26 states sue the administration that the law, Affordable Care Act, is unconstitutional. There's constitution in the United States, and when you pass a law, must go with the Constitution. So you can say, what have this to do with Constitution? The Constitution was around 1782, 85. I don't know exactly the date, but around that time they made and make U.S. Constitution and just part of the Constitution, your freedom. Okay. So here, part of the Constitution say, you cannot impose on us to pay to buy health insurance. If we don't buy it, you give us pay tax. That against the Constitution because you have the personal freedom. Because if you do that, maybe another 5 years or 10 years, you can some say every person have to buy a laptop. And if you don't, we penalize you. And that will be good money for laptop. So you cannot do that. The Obama administration, they said, you cannot drive a car if you don't have a driver license. And that is not against the Constitution. Okay, then you need to pay, have health insurance, or you will get penalized. Same like if you have to have a driver license to drive, or you get penalized. The conservatives say, okay, good point. Let's give you counter argument. They said the federal government cannot legislate and impose law on inactivity. Okay. They said that's true. You cannot drive if you don't have a driver license. But many people don't drive. They don't have a car and they don't have a driver license. Then here's a saying, I don't want to have health insurance. I don't want to use a doctor. I don't want, so you don't enforce it on me. So you cannot regulate inactivity. If I don't drive, you cannot force me to have a driver license because this inactivity, I have inactivity in driving. So here inactivity to be engaged in healthcare. So you cannot mandate it to be in. We have to have, also if you drive, you must have auto insurance. Okay. And here it says, as you must have auto insurance, you must have health insurance. They said no, because people might be inactive in healthcare. So they don't want to use the healthcare. The liberal or Obama administration counter argument. Yes, but sometime during lifetime, you are going to be active in healthcare and seek healthcare service. So you need to have, they said, but the same for driving. Maybe in the future you want to drive, then at that time you get a driver's license and you buy auto insurance. Then you go buy it when you need it. And that argument, no, because that cost and so on, when everybody buy health insurance, you spread the risk. And when you spread the risk, the cost of health insurance goes down and the cost goes down. Next one. Okay. So this went to the court. And it stayed in the court till June 2012. The campaign for the next election in November 2012 was Obama and Romney. So here they said if Romney win, Obamacare will end because he will work against it. But also they say what the Supreme Court will say about the constitutional question might end Obamacare, even if he get elected. What the Supreme Court came and said, the Affordable Care Act, okay, got resolved June 23rd. They say the ACA is mostly constitutional. So they held most of it to be legal. So here it will become a reality. The policy become reality because that's the end of the road, the Supreme Court. What does the Supreme Court say? You can enforce people to buy insurance. If you don't buy it, they pay a penalty because this is considered a tax and the government has the right to impose taxes. So this is not a penalty. It is a tax, which called penalty. So this tax, health tax. So they can impose health tax. So this is constitutional. The ones they disagree with, next slide, please. Okay. They said the state can opt out from expanding Medicaid, which means increase the qualification for poor people to be insured under Medicaid. It's up to the state to agree or disagree. So this way became for people with low income but above poverty line to get Medicaid in a state controlled by Democrat like California, New York, and some other state. One state were controlled by Republican like Mississippi, Louisiana, Texas did not join the Medicaid expansion, okay? So that's basically what I say about the taxing authority of it. Next slide, please. Okay. And here about what I talk about expansion of Medicaid. So Republican governor opted out of Medicaid expansion. So this way, people could not get healthcare free of Medicaid, but still they could go buy low health insurance from the government. But they have to pay like $50, $100 a month, depending on their income. Next slide, please. Yeah. So basically, with the Supreme Court, thank you. with the Supreme Court decision and re-election of President Barack Obama, the political certainty has been resolved, okay? And that's it, it's become law of the land. But here we say not really, because Trump in 2017 came and say what call it Trump care. Next slide, please. Or, so basically what I can say, let's skip this slide because the next one, basically they try to fight it. Let's go to next one. And next one. So next one, we'll go previous one. Here's a website for people who need to buy health insurance from the government called the Market Exchange. They can go with their income, get health insurance and pay a certain amount depending on their income. So they have a government website, you need to do it. And next one. So here President Donald Trump became elected, and he put it #1 goal for him to repeal Affordable Care Act, which is a matter of ideology anyway. So when they came and they said in 2017, because they became president officially on January 2017. So very quickly on March 2017, the Republicans say, we are going to replace the Affordable Care Act with the American Health Care Act. Okay. So basically they propose it, and in it, people will lose health insurance, they estimate. And people with the pre-existing conditions, they can be dropped from their health insurance. So it wasn't that great. So next slide, please. Okay. So they went to the Congress and make a vote. But despite that, the Congressional Accounting Office said 24 million will lose their insurance under the American Health Care Act. Okay. Next slide, please. Okay. So basically, they came and vote on it in the Senate. Of course, in the House of Representatives was completely controlled by Republican. It passed the Affordable Health Care, the American Health Care Act. In the Senate, they control the Senate, but not by wide margin. So they have Republican who, not very conservative, voted against the American Health Care Act, and they needed 51 votes. So they have, I guess, 3 or 4 Republicans voted with Democrats, so it did not pass. So the American Health Care Act did not pass. Next one. Okay. And here, basically, as we say, it passed in the Congress, but did not pass in the Senate. Okay, repeal and replace, that would say, repeal and replace. But they passed it in the Congress, but the House of Representatives, but did not go to the Senate. Next slide. Yeah. So it has failed. The vote was 49 for it in the Senate, 51 against it, so it did not pass. So in this way, that July 2017, they tried to do it again in September, did not go through 2017. So it's ended, stay Affordable Care Act or Obama Health Care as the law of the land. Next slide. Okay. So here you have recommendation what you could do in the future, private vs public health insurance, which is like Medicare for all or not. Health tax on payroll, indirect tax. Health education to improve the cost and the quality of health care, which like exercise, eat healthy, and so on, spend money on health education, okay? And so on, next one. So here basically some slide in the media about healthcare and the media proposing, like here they say it's a cure single payer national insurance. Okay. And here like some slide by Physicians for National Health Program, they advertise. Another one, can go next one. Here like joking about Trump here, when he say everybody will be covered by healthcare, and he say everyone will be covered. I mean, joking about his program. Next one. Here, give you about the politics, like why people oppose universal healthcare, and give you the politics come different opinion, and not everybody opposes it for the same reasons. And he have here like young people say, I'll be healthy forever. And I remember when I thought I will never need glasses, then I had to use the glasses. So that when I was here, thought never need glasses, buy health insurance. And I mean, I will not read it, but here like wealthy people say, who cares? Like there's no problem because they have the money to afford it. And so on. Then you have that racial reason, financial reason, age reason, and so on. So here give you an idea, top 10 reason to oppose universal coverage paid healthcare. So that in politics to get people with different, put them together to oppose or to support for different reason to do that, I mean, which is politics. And I guess that's it. Next one, I guess that's it. Yeah, here give you some idea about coverage. Like state doesn't have Medicaid. State was Medicaid expansion. To give you the coverage and covered, not covered, and the improvement. And basically that's it. The next one is that's it basically. That's the presentation to here. So if you have any question, now we open the floor to questions and answers.
All right, thank you, Prof. Younis. Anybody with any questions? But before that, can I start?
If you go to the first slide now.
First slide.
Yeah, it will be the best thing.
Yeah.
Yeah, so we can have questions about the topic.
Prof. Younis, well, I'm not very well versed with the US health system until recently I read about it, and today I listened to a talk. Correct me if I'm wrong, just to get things into context. So basically in the US, the health system literally, in general, is a private healthcare system, isn't it? Majority of them have private health insurance, and those who are not covered, they're covered by this Medicare, Medicaid system per se.
Well, in reality, as you saw, it's about 50-50, like about 46% Medicare and Medicaid, with expansion maybe about 50-50.
Yes.
So really is not that much as a private.
Per se. So 50% private and 50% government through the Medicare and Medicaid.
Yes.
Secondly, I would like to know.
And children health insurance.
And children health insurance, yes. Secondly, in Malaysia, the health system is tax-based. So basically, majority of the services in our country is paid for by the government and supported by the government, only small percentage out of pocket. And when the states, in Malaysia, we have 14 states. In the US, they have 52. We're not, what do you call this, autonomous. States do not have a say on the budget per se, but in the US they have, So if one state said, I want to give more to the people,
they have their own state budget, but also the state get money from federal government, depend on, like if you look at California, they might be not getting money from the government to contribute. If you look at Alabama, they get money from the government, so it depends on
I see.
economic level. Yeah, some state are.
Economic conditions. So if it's a poorer state, maybe the government will.
Yeah, they have their own budget, but
Budget.
some of them get more from the federal, some give to the federal.
Yeah.
So it depends on the wealth, I mean.
Well, the state.
Yeah, but they make their own budget because they have their own local taxes and so on, land.
Okay, so I just want to get that straightened out. Sorry. Fundamental questions, very basic ones, but I think we just need to be aware. So if I can take a question from the audience online, I can read here from here. This is Professor Husni Jamal, who is actually a very renowned primary care on the screen, Prof. You can see that.
Yeah.
What is the current expenditure? No, just now. What is the current expenditure on primary care? Social health insurance not considered in US?
I don't have up-to-date data to answer the question, but from the slide, you saw primary healthcare, which means physician and so on, about 21%. And my expectation might be still in around that range, maybe 20 to 24%. I mean, social health insurance not considered. I mean, in the United States is not considered. It's still a battle, I mean, between Medicare for all or mix and some other ideas. And the bottom line is politics. I mean, you have people with different ideas and they try to pass it. And you don't have to look at it as really bad in reality, because in any country, like not only United States, you have people with different vision and different ideology and looking for their own interest. And here, when you have representative democracy, people get elected to represent those interests. So you have like people to the left, like for Medicare for all, whatever.
Yeah.
They have people elected them with low income, middle income, and they push for this. The others, they have got people elected them from high income or some other reason. So they have to oppose it because they are elected to represent those. So they are representing those, and here become
correct
the
me if
issue.
I'm wrong, Prof. But social health insurance is actually employer-based, isn't it?
What?
Social health insurance is actually employer-based or work-based insurance, meaning that if you work, you pay. It's a payroll tax.
No, if you work, you don't pay except Medicare. Like now, I pay Medicare 2.9%, and my employer match it is 2.9 till I get 65. I'll be covered by Medicare. The private, I don't pay anything, but it depends on your employer. Some employers, they ask you to contribute, like it costs $1,000 a month to insure you. They ask you to pay $300 from your salary, certain employer, or 50% of it. And other, you don't cover anything. Then you have the benefit, which is sharing cost also. If you look at the German system, here you pay tax about 6.5%, and your employer puts 6.5%, 13% goes to the quasi-government agency to cover universal healthcare in Germany.
Yep.
And in Germany, they have it also, one person in the family is paying the tax. Like if a man and his wife working, one of them pays 6.5% and the employer cover. The other doesn't have to pay it. So not everyone have to pay it. Of course, here in America, everyone pay it when you work Medicare and Social Security for retirement.
Yep.
So that is different. The German system is different.
The German system.
Yeah, you pay the tax 6.5%, while the British is from the general tax. And here, I mean, take your pick, what do you want? I mean, many people prefer the British system. From the general tax, you put budget for healthcare.
Which is not happening in the US at the moment, the VA.
No, because as they like to have people representing different and
politics.
yeah, and to see like who's get control, which is vary from time to time, who take control in the Congress, which means House of Representative and the Senate, and also controlled by how big is the margin, because you need big margin because the party is not homogeneous like other countries. Like you saw in 2017, 3 or 4 Republican move with Democrat to keep Affordable Care Act as a law. So they are not homogeneous. You have conservative Democrat, not many, but they are there, and regular or moderate Republican, not many, but they are there also. So you have to look at those issues. Yeah.
Thank you, Prof. Anyone from the floor? Yes.
I have some questions, Prof. But the first one, what ACA actually aims is the expansion of VA.
What is it?
ACA.
The ACA is actually the expansion of the VA, right?
So what?
The Veteran Administration.
No, it's not. I say you could expand the VA to be cover everybody. Then you have this way like United Kingdom healthcare system, National Health Service. The Affordable Care Act is not that. The Affordable Care Act is having affordable health insurance for people uninsured to be insured, plus the other issue for equality, preventive health care, and so on, and equality and cost.
You said that the public is have defense mechanism. They like to oppose whatever the Democrat offers or suggests. So actually, what the Democrat prefer public based and why conservative prefer private based? What's their justification?
If I understood the question correctly, basically your justification, you can say it's ideology. I mean, as I say, you are representing certain population. You have like a labor union usually supporting Democrat. So if you are a Democrat, you need support labor, minimum wages, whatever, because of your. If you are a Republican, mostly are representing the business. So you are in wages low and people work at lower wages and so on and so on. And, give more freedom for people to and so on. So here become the country going with those issues. So that basically is the motive or the reason for it. Because when you come like to the end of it, last few days, if you look at the media talking about student loans, where Biden administration, he said he might give $10,000 of cancel of student debt. The labor union, whatever, say more, at least 20, but more. Others say 50,000, others say all of it. Okay. You have the conservative, which is represent different people, say, no, this is a waste of taxpayer money. But you have the liberal, which have good argument. It's not waste of taxpayer money, because when you guys in control, you give a lot of subsidy to business and to the rich people, and you waste the taxpayer money on the rich. So here we need to taxpayer money on student and so on. So when you look at it, it's ideological, but you have to like format your policy to say what it is good for, and here become. You say it is for the rich, for the poor, for this, for that. But you can't say it is budget deficit or the, I mean, you make format for your ideology and so on, formatted and presented. But in the end, it's representing your group that support you to be elected. Because if you support me to be elected, then I ignore your need and your whatever. You will not support me next time, and I will lose my job. And you get someone who will support you. And in this case, either I have to be loyal to the people who push me to get this job in the government, or I just lose my election or step down and let someone else to do it. And that goes on both sides. I mean, I know it's look mean, for example, to say, we don't want healthcare for insurance children under 18. Okay, it look mean, definitely. But really what I'm doing, I'm representing social group who don't want to spend money on this low income or higher low income children, for example. You have child tax credit was expired by December. Okay, you have people so opposing it. Well, why you are opposing it? I mean, those poor children, they deserve this $3,600 a year, which is not much, $300 a month for food and other things. Okay, so you have people who said no. I mean, they would rather give it as tax cut to the wealthy than give it to the children, because they are elected by those wealthy group, conservative and other elected here. So you are, if you are conservative and you say, no, I will support this, then the wealthy people will not support you for money for next election. Then you need to step down or you lose election. So that's the idea behind it. I mean, really, it doesn't come at the end about humane or inhumane or you need it or not. The people who elected me, I need to
Satisfy
them and represent their ideas in the Congress and move it. And otherwise, I need to move to the different group to elect me and so on. Yeah.
Okay, thank you, Nasri. Can I just look at our message on the screen? It's from our student council on the screen. Thank you for the wonderful sharing. I'm wondering, as to in the USA, which party are funding the public health services, for example, safe water, food, as well as disease prevention activities and screening. So basically in public health or preventive medicine, who's paying for it in the States?
Let me answer those questions together. You have regulation in the government, what like called OSHA, Occupational Health Agency, and you have the EPA, the Environmental Protection Agency. Those are in charge for like clean water and the environment and so on. And they have their own budget. And so that goes there, and they are important anyway, public health, because if you drink polluted water, you get sick and so on. So they go together. Okay. The other question, when you ensure the poor, increase demand on healthcare, yes, it does, because you need more doctors to do that. And in America, they have reform in the healthcare industry by having what called nurse practitioner and physician assistant can see you and write you medicine, prescribe medicine, instead of seeing physician, because the demand for and supply for physician and so on. So they have two groups can practice as family doctor function and see you, nurse practitioner and physician assistant. And those, they don't need long time to get their degree, like physician assistant, usually 3 years after bachelor, while physician you need 4 years, and you need intern at least 2 or 3. So that narrow the time for them to be qualified and cost less money in tuition, besides their limited number of School of Medicine. I mean, they have maybe 174 schools for 360 million. I mean, very limited number there. So that increased it. Obama administration, after 2010, passed the law. They tried to expand also the number of physicians admitted to school. So they propose like increase the primary healthcare student who will be primary healthcare specialty, which means family medicine, increase them by 5 admission, by 5 every year. and will cover their cost up to $80,000 a year. They get the School of Medicine. For each of those students, $80,000, okay, to help the school to expand the admission. So they have some incentive to increase number of physicians. But United States also is very unique in the world, not in medicine, but in everything. They can get supplies they need from foreign talent. In a way, there may be 60,000 physicians from India, Indian origin. So you can go do the board exam, do the internship, and become practice medicine in America. Also, you have this computer science, like known from India, to go get H1 visa and work, then maybe get permanent resident and live in America and get citizen. For need for people in the programming, computer science, and medicine. United States is unique. They can attract those talent. And you can say rightly so. Historically, everybody wanted to immigrate to Rome during the Roman Empire. And they used to have the German always coming and they tried to push them back. And the same here, United States is very big, wealthy country like Rome. Everybody like to come. So they have this advantage. They can get the talent for the shortage and supply for nurses and physicians. Of course, the requirement, I say, you have to do board exam and so on. And also the quality of life in the United States overall is much better than many other countries. When you go around, I mean, much better, and the salary is very competitive. So it attracts many people to go and try to live there from different talent, low income to middle and high income. And many people go there also get their education in different fields like business or computer, or they stay there, those students, and become productive. I mean, and a few of them become famous, like the guy who did Google with his colleague in Stanford. He immigrated his family from Russia to study, and they make Google. So the other guy, Sun Microsystem, he's from India with his colleague in Stanford that did Sun Microsystem. So, I mean, it has a lot of attraction. So you can get the need locally by expanding a little bit, but also you can get it from overseas. As I say, like everybody like to go, all the road lead to Rome, want to go to Rome here, like almost everybody like to come to America, regardless their talent and background. It's number one, I mean. And yeah, quality of life, I mean, might be good in many other countries too, but compared to many other countries, I mean.
There's another long question. Shall somebody read it from Muhammad Hafizuddin? Thank you for the informative presentation. Oh, yes, that one. Yeah. Some time ago, I watched a documentary movie with the title Sicko by Michael Moore. In that documentary, one of the interviews in the documentary was done among former employees of insurance companies describing cross-cutting initiatives that give bonuses to insurance company physicians and others to find reasons for the company to avoid meeting the cost of medically necessary treatments for policyholders and thus increase company profit. May I get Prof's opinion on this claim and many other claims done in the documentary, such as people who thought they had adequate coverage but were denied care?
Well, I did not see the movie.
Okay.
But what happened here, I mean, is documentary, so it's supposed to be true. Things happen everywhere. I mean, I would say like sometimes you get culture shock. Like if you go to the United States, it's not a perfect country. And you have those, like you have from mass shooting to thief, to honest people, honest doctor, crook doctor, honest engineer, crook engineer. I mean, you have everything. So those cases he documented, and I mean, I don't want to say if he documented and it's there, it is the truth, but those cases are there, and that give you, the system is not perfect. And you hear in news sometimes like corruption, they got, a governor went to jail like maybe 20 some years, 25 years, governor of Louisiana went to jail. And about 10 years ago, mayor of New Orleans went to jail. So, I mean, you have those issues of corruption and shortcutting for cost, and physician who ask you to do things you don't need just to make more money. You have them in those cases. I mean, but it happened in all countries. I mean, anyway, it's a human nature, the greed and whatever happened. So
perhaps even more so, I mean, the probability of this scenario happening with a private company would be higher than that in a government organization.
Well, I mean, you have to look at it from Sicko. I didn't see the movie, but you have to look at it like if you have a salary physician, like for example, they say, why you have few number of physicians in America? And the answer they say, because physician, they have what called induced demand. You can come and you can tell you come again, see me, come again, see me, and that increases the cost of healthcare, but increases revenue. Okay. Do procedure you don't need. Like, let's do this a blood test, but maybe you can go without it. Okay. Or you go to the doctor, say, I need to do X-ray. Well, I don't think you need it really, but they say it's a revenue. Then you go after 2 years again, say that an old X-ray, you need to do one more. Okay. And doesn't make any difference, to be honest with you. So they induce demand. And here becomes the argument sometimes, if doctor on salary, like in different countries, they don't feel they have any incentive to do procedure you don't need. Okay. So we'll be pushing the cost down. So you have those issues there. I mean, and that's why in America, they say, especially for surgery, always get the second opinion, because sometimes you don't need the surgery, but they wish you to do it the surgery. I mean, get second opinion. So that's my answer.
Anyone else? Yeah.
Thank you, Dr. Prof. Mustafa, for the interesting presentation. I have actually two questions. The first question is, as of today, still the uninsured population, it is an issue in USA. What is the current figure and what's their future plan, actually? And the second question is to overcome the drawback of expansion and coverage, how we can minimize the unnecessary use of healthcare services that might contribute positively to this decision.
Well, as I presented, they say by 2019, 94% of the insured will be insured. That's not achieved. Around 2010, you have about 50 million uninsured. By 2016, there were about 22 million uninsured, 20 million uninsured. Now, the latest estimate, they expect about 15 to 20 million. I don't have the right figure, uninsured. So still didn't reach the 90%, 94% goal they had. But the number of uninsured is way, way down. But the problem, we have to look at always the underinsured, like those insured, but are they insured or underinsured? Because the insurance doesn't cover 100%. And here it becomes something for major things, like really you have heart attack or cancer or something, you go and do it. But you have some other regular illness, you might postpone it and then do it, which sometimes become more costly when advanced, anyway. But as insured, for me, personally, I believe we need to focus more on underinsured, because that's the real problem. You need to have insurance that you can receive the service.
False statistics.
Receive the service, but yeah, it's improved a lot. I mean, less than 20 million uninsured now, which refer to the Affordable Care Act and the Medicaid expansion also, helping many people to get insurance.
Anyone else? Yes, Naresh, go for it.
Morning, Prof. I'd just like to clarify about the VA for the Veterans Health
Administration, yes.
Administration. Is it true that these veterans who have been discharged, had this honorable discharge, are only treated for their disabilities caused by their work-related injuries? That means during the tour of duty, they've sustained an injury, so they are covered. But for illnesses like hypertension, diabetes, and cancer, they are not covered under the VA?
People who are discharged honorably and my understanding, they go for diabetes, they go for regular. I have a friend who's a primary healthcare doctor. I mean, she worked for the VA, and she told me, I mean, people come for different condition and they have different co-payment, different share. Not all of them pay the same amount. I mean,
So they still pay.
they still pay, but it's vary. I mean,
Are their families covered? Are the military families covered under the VA?
yeah, primary healthcare, that covers the.
That means it's
primary
wife
healthcare.
and children.
I didn't know about wife and children. I didn't know. I don't want, because I didn't really do much, not much. I didn't do any research about VA administration and military healthcare system. I did not touch this area yet. I mean, might be here you get a new idea for a new article to publish from questions. You can take a look and see it. So I didn't know about their family. Definitely when you work, you can insure your family with you, but when they are discharged or retired, I didn't know.
Anyone else? Questions? Yes. Nahul? You have a question? Okay.
Well, so I have one question regarding ACA, Affordable Care Act. To my understanding, it is actually to prevent catastrophic out-of-pocket expenditure. But is there any possibility that there will be increased out-of-pocket expenditure on the poor and very poor population that it can be catastrophic?
Well, I kindly disagree with your statement. It's not to cover catastrophe, it's to cover everything. I mean, to cover normal healthcare service for the people insured. And I mean, when increase their cost, I mean, it depends on what the insurance they have, how much they have to share. Usually if they go for Medicaid expansion and Medicaid, usually they don't have to pay anything. I mean, but if they have the other kind of insurance, usually their shares they have to pay. But if they are in certain income, they can have the other 20% or 30% covered by Medicaid. They have to get both insurance. Like people in Medicare, if they have low income, they can get Medicaid and Medicare because Medicare cover 80%. So they get Medicare, or if not, they have to pay out of pocket the 20% or pay supplement insurance to cover 20%, or go to what called Medicare Advantage, health maintenance organization, where cover 100% or almost 100%, but they need to use certain doctor and facility in the work. So there's an option there.
So for the healthcare.com, is it compulsory for the poor and the population to buy insurance?
No, because Trump administration in 2017, the Senate and the Congress repealed this mandatory health insurance. It's no longer mandatory.
Oh,
They repealed it.
Prof, the benefit package for Medicaid and Medicare, are they very extensive or very superficial? They go.
No, the Medicare is more generous for the hospital and the physician. Like Medicaid, I don't have the data, but let's say Medicaid pay, no, let's say if you are a private health insurance, you pay the doctor $1. Medicare pay you about maybe 76 cents to the doctor, less. Medicaid pay about 67 cents, they pay less. And that's why many doctors or hospitals will not accept Medicaid because they get paid less. There's always debate about this issue. Like someone wrote in a column, said, if you are an orthopedic surgeon and you take a private insurance, you make about $850,000 a year. If you take only Medicare, you make about $500,000. So here's the argument. You make about $300,000 less, but still you make good money, about $500,000. So you don't go over Medicare, says they pay less. I mean, it's not good. When they say Medicare for all, some people say Medicare for all doesn't pay as private. So there were an argument, okay, it doesn't pay as a private, but still you make good money. I mean, $500,000. So why not? Let's have Medicare for all.
Has the US population complained about inequity or inequality in healthcare? Is that, don't they?
Well, I mean, for any system, you have inequality in income and healthcare and education in any system and in any country. And that will vary from place to place overall. I mean, you might have this country like in, say, free education in Germany, so maybe inequality in health and education less in Germany than in United Kingdom. So it is there, and as I say, there's different group in who elect you to be in the government to make a policy, who going for more equality or less, like less taxes on the wealthy, more taxes on the wealthy, and more taxes will narrow the equality gap. I mean, same for education, it's expensive. So here become like free education or lower cost education, abolish student loans as problem. I mean, and you have to look at it in certain ways sometimes. Like, for example, when you look at university like Harvard University, they cost you just tuition about $60,000 a year. And they say, why it is that much? When you look at it, you find they admit about 6-7% of the people who apply get admitted. So when you look at it as supply and demand, you have that much, many people there, and they take only 6 and 7%, and the other 50 or 80% willing to pay the 60,000.
Yeah.
Then why to reduce it to 40 or to 20? People are willing to pay for it. Yeah. So you have to look at it from the point of view. I mean, why I have to make it 10,000 and people willing to pay 60? I mean, so leave it that way.
What's your opinion on tax-based health system? Is it the way to go? Is it
Which one?
tax-based, like NHS, UK, like Malaysia, tax-based?
Well, many people think the United healthcare system, the United Kingdom healthcare system is the best because it's coming from the tax base, and many people are in salary, and it covers everything, so it's good. But you need to remember the problem overall is not only in health insurance and coverage. The problem is more than that in lifestyle, okay? Like health education and lifestyle. For example, the disparity in healthcare outcome in the United States is very clear. If you are higher income, you have better health outcomes than low income. Okay, but they did a study in the United Kingdom, because in the United Kingdom you have also low income people. And they found even you have the free universal healthcare, the health outcome for the higher income people is much better than the lower income. And that comes from many reasons. I mean,
Education. Lifestyle.
well, I mean, you have high income, have poor lifestyle, eat too much and drink too much. But you have like nutrition, for example, stress, worry about paying your rent, worry about paying your for food, the kind of food you cook and eat, and so on. If you have higher income, you have better quality food and better quality. The house you live in maybe have better lighting and more quiet. If you are low income, maybe more noisy, more. So you have more things you need to take care of than just free healthcare to improve the outcome. The gap in income and quality of life. I mean, no doubt when you have higher income, when it is cold, whatever, you go to your covered garage and drive your car and go to work. While you are low on income, no garage, but maybe no car, you have to walk in rain and cold for the subway or the bus. And that in long run affect maybe, yeah. So there's other things, I mean.
Apart from the financing.
Besides like universal healthcare, it's not going to solve things. Look at equality in other things and education to improve it. I mean, in higher income, you might have very nice park, you can walk and enjoy your time. In lower income, you don't have those nice clean park, you walk and so on. Even maybe you don't have time to walk, you have to get two jobs.
Yes.
Maybe you have two jobs. I mean, no time to walk or do something. Any question?
Any other question?
I have.
That's me. Okay, ladies first. Okay.
So Medicare and Medicaid, is it there is strict eligibility to apply for Medicare and Medicaid?
Well, for Medicaid, there's of course government office, and you can have the internet now. You apply, and they decide if you are qualified because it go by income and assets, what you have, and so on. For Medicare, you have to work 40 quarters and contribute to the system. So if you did not pay for Medicare, you are not qualified. Let me give you an example. If you are 65 years old and you have a son or daughter in America and you immigrate to America, you are 65, you are not qualified for Medicare because you did not contribute. Okay. While when you contribute, like I guess a few months before you turn 65, you can go to the internet or go to Social Security office, apply for Medicare. Okay. And they send you a card with Medicare and Medicare number. And when you go to the hospital with the doctor, you present it and they bill Medicare. So it's easy, yes, it's easy. It's not a problem. I mean,
Is there any lesson learned that happening in US that you think is applicable to Malaysia?
what?
Is there any lesson learned that happening in US that you think is applicable to Malaysia? Because we are going through health reform.
Well, I mean, you can have your own system depending on your politics and government to have people 50 and above have free health care or 65 and above. But always you have to look at a question as a policymaker, who's paying for it? And where are you getting the money from? So that will depend. Like if you go to Qatar, for example, or United Arab Emirates or Kuwait, okay, they give you free healthcare 100%. And who's paying for it? It's good oil revenue. At the same time, if you go to Kuwait or United Arab Emirates, if you are not a citizen, you are not getting the same healthcare like non-citizen. So you have to pay for certain procedure and certain medicine, and you pay when you see the doctor. It's not 100% free. It's only for citizen. I grew up in Kuwait in the 70s. It was 100% for everyone. Then they want to save money. They started in the mid to late 80s. They want to save money. They start saying, everything cover 100% for citizen. Non-citizen, they have to contribute because they want to save money in the budget. Doesn't mean they don't have money, just they don't want to pay that much for non-citizen money. So they want them to share some of the cost. So that's what you need to look at it always. In Malaysia, want to do this, want to do that, who's going to pay for it? And do we have the money to pay for it? Okay.
One last question from me.
Yes.
You said that so far 36 states joined the ACA, right? The Affordable Healthcare Act. The 36.
They don't have to join it. It's the law in the 50 states, the Affordable Care Act. The Medicaid expansion, some states refuse to do it. And President Biden tried to include all states by what called Back America, the one they have President Senator Manchin refused to support. In it, some parts, it has many things on it. One part of it to have Medicaid expansion in all states, but I mean, it did not even go to vote yet, this package. But you have more than 20 states. There's 26 states now have Medicaid expansion. Like Louisiana, they have Republican governor and legislature. They refused to join. Then I guess in 2015, we got Democrat get elected, and he joined the Medicaid expansion. In Ohio, I guess they have Republican governor, but he joined. He felt it's good for the state. I mean, so I guess now maybe you have 30 states have Medicaid. You can Google it to find how many states have Medicaid expansion at this moment. Yes, sir.
Oh, I think you have already answered. My question was current administration under leadership of the President Joe Biden is keen on ACA or the AHCA under Trump?
Keen on what?
I mean, is he more on the
Obamacare or Donald Care?
Or the Trump.
No, definitely he was the vice president during President Obama. I mean, he wanted to expand it and strengthen it. Okay. And there was an article a few days ago saying he has very narrow time. He needs to push for it because he might lose control of the Congress in 2023 when the election come in November. And they say, but he got now like taken by the COVID problem and Ukraine-Russia problem, taking some of his effort to push more for strengthening the Affordable Care Act. And he have very narrow time to try to do something about it. And if they can get that last two senators from Arizona and West Virginia to support his package, part of it have strengthening the Affordable Care Act. You're welcome.
Thank you, Prof. This is our doctor's just want to know the healthcare financing in United States.
Yes.
So actually, what because okay, right now the ruling party will be the Democrat, right?
What?
The ruling party will be
Yes.
the Democrat.
Yes.
So we got the states that owned by Democrats, and also we got the states that owned by Republicans. So for the healthcare financing and for the budgeting, is it central? Is it mean that all states will get the equal healthcare financing or budgeting, or the states that owned by the ruling party will get more? How did the systems want to do
Yes.
this?
There's laws and regulation going on, and they're what called state rights and state freedom in certain things. So it matter only in certain things like Medicaid expansion, state controlled by Republican or conservative refuse to join Medicaid expansion, even it helps their population to have better healthcare. But for ideological reason, I mean, they don't want it. Because when you have two parties, they won't have legacy in long run. And like our party did this, our party did that. So they don't want to give easy way to the other party. Say like the Democrat have social security, they have minimum wages, they have Medicare, they have Medicaid, and now they have Affordable Care Act. So the other party want to have some legacy. So, but when it goes for funding and other things, have to go to all state regardless. But the state has certain freedom in certain things they can go with or not. They can be more generous in certain things also. But there's minimum, I mean, they have to meet. Any question?
One question. Do they have healthcare subsidies in America?
Yeah.
And what is your opinion on healthcare subsidies? Is it a good thing or?
But the healthcare subsidy is the Affordable Care Act. When you go get insurance for $25 a month or $50 a month, who's paying the difference? I mean, coming subsidy from the government. And I mean, the argument is very easy. You subsidize them, but the government also subsidizes big business. I mean, big pharma gets subsidy for farming. Big business gets subsidy by like no taxes for a certain number of years to build the land or this and that and so on. So the subsidy is there for the wealthy and non-wealthy. And here, I mean, of course, we need to give this more here or less here or nothing, but subsidy is there.
Is that the wealthy also get subsidized?
They get subsidized in certain things, yeah, in different ways. Tax deduction, land, like if you have certain investment, you could maybe waive taxes, lower taxes. Like you build a plant in Ohio, say, okay, 20 years, you don't have to pay any tax to the company, or 10 years or whatever, subsidy. I mean, just to come build it and create jobs and so on. So the subsidy is there, I mean, in different forms for different segments of the population and the economy, different segments of the economy.
Any other questions? Guys, anyone?
One of the strategies the ACP is to procure or to lower the cost of the healthcare. So what are the specific strategies in the ACP that bring down the cost?
Yeah, okay. The ACA had, as we say, expand the coverage of insurance and reduce costs. Many of them direct and indirect way to reduce costs. Like when you have a preventive healthcare free, that reduce cost, you catch something before it advances, like breast cancer screening, colonoscopy, and so on. That will reduce cost by catching things early and so on. That one example. You have other examples, electronic health record. They say you need to implement electronic health care record because this improves cost and improve quality, because you have errors in writing and reading, so you have everything, and also storing the record electronically save money than you have the paper all over the facilities. So they did subsidy by giving like a doctor office clinic, like say, we'll give you $60,000, for example, to implement electronic health record. But by year, like 20, I don't have the year handy, but let's say by year 2014 or something like that. If you don't implement it, will reduce your payment on Medicare. So they make incentive for them, will give you money to assist you to get the record to be electronic and the computer, but will not force you, you have to do it. The only, like what called the carrot and the stick. The carrot will give you subsidy money to buy computer and healthcare record and the system and so forth. The stick, after a number of years, if you don't implement it, we are going to take 2% from your payment for Medicare. So when people come use Medicare. So this move clinics and hospitals use electronic healthcare record. And I know it is a system there now. They have stages. I mean, they have stage 1 to implement healthcare record, stage 1, stage 2, stage 3. They postpone the deadline for full implementation because they get feedback like certain hospital and organization is long time. But I think by the time it's fully implemented, people who don't implement it will pay penalty. Don't pay penalty, they get lower payment. But I think wherever I go, I find it there.
Okay, Prof. Anyone else has one question? Oh, from there. Somebody's having a question. How about the people with income below poverty level? Are they eligible for Medicare or Medicaid? Are they covered by the employers?
Well, as I said, for Medicare, you need to contribute 40 quarter. Like you work 40 quarter and you pay currently, I guess about 2.93% and employer match. You are qualified for Medicare. For Medicaid, it go by your income, and the state have leeway to decide what the income. So if you are in California, for example, I know you might be above poverty line in a certain way, you can get it, while in Missouri, you need to be very poor to get it. So, but yes, you get it if you are low income.
I think that it's already 11, so I think we'll wrap it up. If you, Prof, would like to just summarize, in your opinion, what would make healthcare reform in a country successful, considering the fact that Malaysia is about to, planning to go for a healthcare reform. So what?
It's okay. Yes.
What do you think is the success factor to aid in a country's healthcare reform? What is it? What's the?
Well, it's my opinion, of course, from my reading and looking around and from the presentation. You need the political will, and the political will come from the system. If you have like elected representatives, it's not like a dictatorship system where you have people elect their representative. The people need to be active in their lobbying and pushing their representative for the system. That's what it is, the political will for the country and the population to move in it. As I said, in America, you have 5% of the population have 25% of the wealth. But there's no political will to have universal health care like United Kingdom, for example, or Germany, or France. I mean, so that is going to be the main factor. Of course, you can add like the culture, the attitude, like in certain countries, like you say, political freedom, personal freedom, but it's still
At the end of the
to
day,
the will of the population.
hopefully,
What you pressure and move forward.
so hopefully the academia's people with knowledge would help lobby and advocate for.
Yeah, I mean, they can do, but as I said, you have a lot of good pieces of universal healthcare written by those scholars, think tank in Washington and other places in the 70s, 80s. I mean, but
At the end of
they
the day.
never passed because there's no political will
No
to push it.
political will. The key word here is political will.
Yeah.
Well, we've come to the end of the session, Professor. So if there are any other burning questions later, maybe you can send the questions personally to Professor Younis through email. So on behalf of the department and the faculty, we would like to extend our gratitude to Professor Younis for a 2-hour lecture on healthcare reform. We've learned a lot about the health system of the United States, and you know, indeed there are some lessons learned, take-home lessons. So you guys, as future public health specialists of Malaysia, they're in the first year, so they have another few years to go to become specialists of the country. So maybe you can take some knowledge from this lecture, and internalize it and use it as a background for your future work as administrators in the health ministry. And also Naresh, Dr. Naresh is from the military, so he's going to take home messages to the Ministry of Defense. Okay, so
Well, if you have any question, you can email me, and I'll be happy to answer your questions down the road.
With that, I would like